registered dietitian and certified diabetes care and education specialist at Titus Regional Medical Center. Today, our adult support group will be discussing blood glucose management, the lows and highs that can occur when living with diabetes, and how to navigate safely through an illness or a sick day. Welcome to the Adult Diabetes Support Group. The basic skills that can help us manage diabetes can be remembered by the M's in each of their names. Often discounted, blood glucose monitoring can tell the person with diabetes how their management steps are working. It ultimately gives you and your team the information about how your meal plan, movement, diabetes medication are doing on a day-to-day basis. Just starting to monitor more consistently, either by a finger stick or by wearing a continuous glucose monitor, often produces decreases in the blood glucose numbers. So some blood glucose targets are shown here. The American Diabetes Association recommends that people with diabetes test their blood sugar either before a meal or 2 hours after meals. Blood sugar targets for before a meal are between 70 and 130. And 2 hours after meals, the blood sugar should be less than 180. If your physician is also running A1Cs every 3 months, it's recommended that your hemoglobin A1C, which is your 3-month blood sugar average, be approximately 7% and below. And that's an average blood sugar of under 154 milligrams per deciliter. Hypoglycemia is a common complication of diabetes in that sometimes the blood sugars aren't what they should be, and perhaps that they would be less than 70. Hypo stands for low, glyce is the abbreviation for glucose, and emia is for in the blood. So hypoglycemia is just the medical term for low blood sugar. And again, it's defined as a blood sugar below 70. Hypoglycemia causes include things like taking certain diabetes medications and eating too few carbohydrates, skipping or delaying a meal, taking too much insulin or too much sulfonylureas. These are oral medicines like glimepiride, glyburide, or glipizide. And if you suspect that maybe your dose on your insulin or your sulfonylurea is causing the low blood sugar, this is definitely something you want to discuss with your diabetes team and your physician. Also, being more active than usual can cause some low blood sugars, and being ill or emotionally stressed. And drinking alcohol on an empty stomach. A lot of people are surprised by that, but some forms of alcohol can actually cause severe low blood sugar a short while after drinking them, especially when the alcohol is consumed in large amounts and on an empty stomach. So here are some signs and symptoms of a low blood sugar. They can start with mild symptoms like sweating, weakness, hunger, anxiety, trembling, fast heartbeat, headache, and numbness or tingling around the lips, and even nightmares or restlessness while sleeping if it happens during the night. What symptoms you have can vary. Each person might have slightly different symptoms, and you might not have all of the symptoms that are on this list, but that should be a half cup of soda, not a half can, or 1 tablespoon of sugar or honey. After you treat the low blood sugar, you would rest about 15 minutes, and we recommend retesting to confirm the blood sugar is above 70. If it isn't after 15 minutes above 70, we recommend repeating, treating again with another 3 to 4 glucose tablets or additional 4 ounces of juice, and then repeating again after 15 minutes. If the blood sugar has been high for some time, low symptoms might occur at levels above 70. So I just want people to realize that if their blood sugars have been running 200 and 300, even when they come down into the normal target that I gave earlier of 80 to 130, they might still have some symptoms for low. And it may be better if they test and their blood sugar is not technically below 70, not to get big guns like 4 ounces of juice or soda, soda to raise it, but instead to have a small snack like a piece of fruit that's going to raise it more gradually. We want for them, as their blood sugars reduce and come into that normal range, to have a chance to kind of acclimate and get used to those blood sugars in the 80 to 130 range. So if you're grabbing juice or soda each time your blood sugar comes down into that range, that's popping you up so quickly it may make it harder to adjust to the normal levels. Certainly, if the blood sugar is below 70, we do need to grab something that's going to raise the blood sugar very quickly. And best choices are some of the things we listed earlier, like the juice or the soda, because they have pure sugar. They're going to raise your blood sugar very quickly. If you're having symptoms even when you're not low, follow your management steps. Try to be more consistent with your meal timing. That can help steady your blood sugars, and that will certainly help you feel better as your sugars normalize and come down to that normal limit. Also, with hypoglycemia, it's really important not to be driving a motor vehicle or even a tractor for that matter if you think you might be low. When you're low, it does affect your manual dexterity, it can affect your judgment, and it can be really harmful to be behind a motor vehicle or a piece of equipment if you're having a low blood sugar. So stop the car, pull over on the side of the road, or pull into a safe place and treat that low. Don't drive that vehicle if you think you might be low. Always carry a source of glucose in your car. It's a good idea to have some glucose tablets in your glove box that you could use to treat, because you sure don't want to realize I'm low and I have nothing I can do to treat this low in this vehicle with me. So have some glucose tablets in your glove box as a safety, especially if you've been having trouble with lows. Have your diabetes identification clearly visible. Keep a diabetes wallet card by your driver's license. If you weren't able to communicate to a healthcare provider or EMS that you had diabetes and you were in an accident, these could be life-saving for you, because they could communicate to that emergency medical care provider that you have diabetes and that they need to be monitoring your blood sugar. If you have a low at night or after exercise, after that initial treatment, like the 4 ounces of juice or soda, you may need to follow with a small snack to ensure that your sugar makes it to the next meal or snack without going low again. So if it's going to be several hours, an hour and a half or more, till your next meal or snack, it might be a good idea to then have a small, maybe 2 or 3 crackers with a little peanut butter to ensure that your sugar stays at a good level until the next meal that's coming. For severe low blood sugar, we could have more pronounced symptoms like confusion or even staggered gait. Somebody might have trouble walking or balancing because they have a severe low blood sugar. They might lose consciousness or actually go into a coma, or they might have seizures or convulsions. When somebody has a severe low blood sugar, it's going to impair their ability to take care of their low. So it's not going to be possible perhaps for them to walk to the refrigerator to get some orange juice. They may need some help from a loved one or a family member. So it's really important to have loved ones that are aware that you have diabetes, and if you've been having trouble with low blood sugars, that they're knowledgeable about what they can do to assist you in an emergency. Examples might be they might administer some glucagon, which I'll talk about in just a second, or some glucose gel if they found you in a situation like unconscious or seizing. They should also be prepared to call 911 to have EMS come and make sure that you're safe and that you've recovered okay. Even if they administered glucagon, that they would check you over. So glucagon is a hormone that's going to help your liver release stored sugar to raise your blood sugar level. It is used only for severe low blood sugars. So if somebody can swallow and they can function, they're going to drink some juice or they're going to use some soda to raise their blood sugar. But if they're incapacitated, if they're not able to swallow, or if they're seizing or unconscious, glucagon is an injectable medicine, and it's also available by inhaler that can be used to raise somebody's blood sugar by helping their liver to release some sugar into the bloodstream. It can be administered, like I said, by family and loved ones. It's not a requirement that this be administered by EMS. It's something that family and loved ones can be trained to give. It's given by injection or by inhaler, and it should be kept in the home when someone has experienced severe hypoglycemia reactions. And we also recommend we should keep one of these, either the inhaler or the injection, in a home if you take multiple injections of insulin daily. You absolutely, after administering glucagon, should call 911 and be evaluated by EMS. On the other side of things, when the blood sugars are too high, for example, they're higher than 200 milligrams per deciliter, the name for this medically is hyperglycemia. Hyper standing for high, glyce for that glucose or blood sugar, and emia in the blood. So basically, high blood sugar is defined as or caused by too little insulin or diabetes medication or exercise. It's caused by eating more carbohydrates than usual. Over time, weight gain can lead to high blood sugars. Using old or expired insulin can lead to highs. Even illnesses or infections can lead to higher blood sugar readings, and also stress. Some symptoms for high blood sugar include mild symptoms like frequent urination, increased thirst, dry skin and mouth, fatigue, and even blurred vision. And severe symptoms might include dehydration, loss of energy and lethargy. It might be some confusion or coma, or even possibly stroke. So you're seeing several symptoms that are similar to a severe low blood sugar also on this list of high blood sugars. So before treating, it's always a good idea to test a blood sugar to see what's going on here. So how do we treat high blood sugar? First, if the person's aware, then they should try to identify what may have caused the high. They should absolutely take their medications, and if this is due to an illness or a stressor, they may want to call their doctor to find out if they might need to increase or adjust their diabetes medicine due to that illness. Sometimes treatments like steroids that are used for respiratory illnesses can lead to high blood sugars, and the doctor may need to increase your diabetes medicine the entire time that you're taking that steroid, for example. You should eat planned meals, so don't start fasting or skipping meals because of high blood sugars. That actually causes the body to produce more of its own sugar. You actually put yourself in a position where you may actually make your sugar go even higher if you skip meals. Drink plenty of sugar-free liquids. Absolutely, these should be sugar-free liquids, and one of the best ones would be water. Make sure you're staying well hydrated. The recommendation is generally 8 ounces or 1 cup of water per hour is recommended if your blood sugar is above 200. Also, check your blood glucose every 4 hours, a minimum of every 4 hours until you're back at target, and check your urine for ketones. We'll talk about ketones in just a second, but when your blood sugar is high, one of the dangers is you may start making an acid called ketones. So it's an easy thing to check for, and we should be checking our urine for ketones about every 4 hours, just like we're checking our blood sugar every 4 hours. Contact your medical team to discuss if your blood sugar is not improving within 24 to 48 hours of this intervention. So, ketones are acids that can build up in our body and be very harmful to us. Our body will produce ketones if we have type 1 diabetes or we have long-standing type 2 diabetes, and it produces it by breaking down fats for energy or for fuel. And our body produces these because we lack the insulin to move that sugar in from the bloodstream into the muscles or into the cells for energy. So our muscle cells, when our blood sugar is really high, our muscle cells are starving, and they actually start to burn fat for fuel, and that's what produces these ketones. The symptoms of a dangerous situation called ketoacidosis include fruity breath, loss of appetite, nausea, vomiting, abdominal pain, difficulty breathing, confusion, and coma. If you have these symptoms, it is really very important that you check and see what your blood sugar is, and if your blood sugar warrants checking for ketones, that you check your urine for ketones. So here's when we recommend testing for ketones. In type 1 diabetes, it is generally recommended if your blood sugar is over 250 or you are sick, that you check your urine for ketones in the morning, and then if it's above 250, every 4 hours thereafter. If you have type 2 diabetes, if your blood sugar is over 300, you should absolutely be checking your urine for ketones, and every 4 hours until your blood sugar and your ketones get back to normal levels or negative for ketones. If those ketones are positive, it is so valuable to stay well hydrated. So one of the most important things that you should be doing at that point is drinking plenty of water and sugar-free liquids. Again, the recommendation is at least 8 ounces of water or sugar-free liquids every hour, and recheck your sugar and your urine ketones every 2 to 4 hours. Call your healthcare team if the level of ketones tests moderate or large. So I have some ketone strips, and on these ketone strips, they come in a bottle similar to this right here. And on the side of the bottle, it's going to be hard to see, but I think you can see a color range. What you simply do is you urinate on your ketone strip. There's a little piece of felt at the very end, and you urinate on that end. And you wait about 15 seconds. That felt piece, if it stays that same color, that means that your ketones are negative, which is the end right here. But if that color on that felt piece starts to turn to a pink or even a deeper pink, almost maroon color, that's a moderate or large amount of ketones. And that's an alert. That's when you should be calling your doctor. If this is the weekend and you can't speak to your doctor, that's when you should go to the emergency room for treatment. That's a moderate or large amount of ketones. So these are something that you can buy over the counter at the pharmacy. You don't have to have a prescription, and it's a good thing to have a container of ketone strips if you've been having trouble managing your blood sugars and your blood sugars have been running 250 or 300 or more. It's also important to remember these ketone strips do have an expiration date, and so check the container if you go to the store to buy some ketone strips, and buy the bottle that has the expiration date that is furthest back, so that you can keep those ketone strips until that expiration date. And hopefully that's about a year and a half before they expire. So simple to test. Again, if you have type 1 diabetes, if your blood sugar is above 250, I would recommend testing for ketones, testing your urine for ketones. And if your blood sugar is above 300 with type 2 diabetes, again, you should check your urine for ketones. And that's every 2 to 4 hours, or until your blood sugar comes down back into that normal range, preferably into the 100 range, and the ketones are negative. All right, so call your doctor if ketones persist and you have them more than 12 hours, or those ketones are rising, they're getting to the moderate or large level. Call your physician if your blood sugar has been running greater than 250, or if you have vomiting persistently. Call also if you have a fever that is greater than 101, or if you've had a fever for more than 24 hours, because that can indicate that you may have an infection and that needs to be addressed medically. Remember, blood sugars, it is very important that we check our blood sugars regularly. Whether we think we're high or low, we should check to confirm whether we are or aren't. Sometimes the symptoms for highs and the symptoms for low can be very similar, but the treatments for high and the treatment for low are totally different. So we want to make sure that we confirm with a blood sugar check before we grab that orange juice to treat that we are actually low. If it turns out we're actually high, it really is recommended that we drink water and we don't grab that juice. Hypoglycemia can often occur rapidly, and that can mean you might feel fine, and within a few minutes, you might not feel fine. So hypoglycemia can come on pretty quickly. So you want to be prepared. If, again, you were in the car, it's a wise thing to have some glucose tablets. And I just want to show those. I have a bottle of some glucose tablets here, and these are kind of large. I'll just remove. They're a large round tablet, but I will say about these glucose tablets, if you're low, you really do have to suck on 3 or 4 of these, and that may take a few minutes to consume those 3 or 4 because they are large. You put one in your mouth, let it dissolve, chew it up, throw in the second, third, and finally the fourth. But glucose tablets are available over the counter at your pharmacy in the diabetes section. And they've also got fun things like glucose gummies now, and this is a glucose shot. One thing that I do know is that there's about 15 grams of carbohydrate in the entire container. Sometimes people wonder if they should consume the whole container, and the answer is if your blood sugar's below 70, you should consume the whole thing. At least 15 grams of carbohydrate, wait 15 minutes, and recheck it. And that was that rule of 15 for low blood sugars. Some people grab Dr. Pepper when they're treating a low, or Coke, right? They think, gosh, this is something I normally don't get to drink, so here I get a chance. The key to remember with a bottle of Dr. Pepper is there is 64 grams of sugar or carbohydrate in just this one bottle, and we only need 15 grams of carbohydrate to treat a low blood sugar in most cases. That means I don't need to guzzle the whole bottle of this Dr. Pepper. I just need to drink about a half cup or 4 ounces, which would be a fifth of this bottle. So be careful if you're grabbing soda pop to treat a low blood sugar that you don't get tempted to overconsume it and go from low to high. And that's something that sometimes is going to happen. Life happens, and sometimes things aren't perfect, right? But you want to fight that urge to over-respond to low blood sugars. So low blood sugars can occur quickly, and you want to be prepared. And those are just a few items that you can use to treat that low. High blood sugars usually don't happen overnight unless there's a severe illness, maybe, or some medicines that really spike the blood sugars. I think of steroids as a possibility of that. High blood sugars typically develop more slowly over hours or even days. Everyone's blood sugar sometimes is not what it really should be, but the key here is it is so valuable to test the blood sugars. One of the biggest dangers of diabetes is you can feel fine when your sugars aren't fine and when your sugars are high. So that monitoring piece that I mentioned is one of the key management steps to diabetes. It is so important to test your blood sugars consistently and regularly. So I urge each of you to choose one thing today or one thing this week that you might do to better care for your diabetes. Also, as I talk about some emergency situations like lows and highs in diabetes, would be remiss if I didn't talk a little bit about sick days, because sick days are days that can really trigger some challenges in better managing the blood sugars. When you have diabetes, illness can change your blood sugar patterns. It can make for more variation and more swings in your blood sugars. And so it is really important during an illness that you really keep a close watch on what your blood sugar is doing. Probably at the time, like this young lady looks in this picture where she probably least feels like testing her blood sugar, this is a time that she really should be faithfully testing her blood sugar because she may have more variation in her blood sugars. So some sick day guidelines are presented here. They include some of the same things we did for high blood sugar, like drinking plenty of sugar-free liquids. There is a recommendation that you keep some sugar-free, caffeine-free liquids. So things that are water-based, even sugar-free Kool-Aid or Crystal Light, rather than maybe tea or coffee that contain caffeine and sometimes contain sugar too. We want to use things like sugar-free, caffeine-free liquids, water being the best choice, and drink at least 8 ounces every hour. We should check our blood sugar more regularly. Again, it's recommended we test every 2 to 4 hours, especially if you've been vomiting and having trouble keeping food down. We never want to skip our insulin or our medication dose. I know you might think, gosh, I'm not eating very well, so maybe I shouldn't take my medicine. But the problem is here that stress and illness are usually going to cause blood sugars to go high rather than low. So it is recommended that you try to take your diabetes medicines consistently as they're prescribed. You should also check your urine for ketones whenever you're sick, especially if your blood sugars are above 250 or again 300 if you have type 2 diabetes. And take your temperature, because you need to be able to alert your healthcare provider if you're running a temperature and make an appointment to get in and see somebody if your temperature is greater than 101. So what if you don't feel like eating? On a sick day, it is really important that you still get adequate amounts of carbohydrate from what you are able to consume. Carbohydrate is your fuel, so it's what your body needs to fight this infection. And it's generally recommended that we get about the same amount of carbohydrates on a sick day as we would on a normal day. If we normally have 30 grams of carbohydrate at lunch, we still need 30 grams of carbohydrate at lunch even though we're sick. So for sick days, some foods that can help us get a little bit of carbohydrate from our meal might be drinking a small amount, 4 ounces of apple juice, which has 15 grams of carbohydrate, or drinking a cup of maybe a Gatorade or a sports drink, which has 15 grams, having a cup of soup, a cup of plain yogurt, a slice of toast, or maybe 5 or 6 crackers. So a meal might look like a cup of soup with 5 or 6 crackers to get 15, that would make 30 grams of carbohydrate at that meal. Or a meal might be a cup of a sports drink with 5 or 6 crackers. So these are soft, easy, digestible foods that we can use when we don't feel up to eating our normal meal. Certainly, if we have an appetite and can eat a normal meal, we should try to do so. But on a sick day, if we're nauseated, these are some light, easy things that we can incorporate to ensure we still get a little bit of carbohydrate for breakfast, lunch, and dinner, and our body has the energy it needs to fight that illness that we're dealing with. When should we call our doctor during this illness? Absolutely, if we're having trouble breathing. That might be a warning or an indicator that you're making some ketones, and that's really important to alert your provider. Also, if you're having vomiting that's lasted for more than 6 hours, or diarrhea that's lasted more than 6 hours. If you've noticed that you've lost 5 pounds very suddenly while you've been dealing with that illness, that could indicate dehydration. If you've got a temperature more than 101, if you've had 2 or more blood sugar readings greater than 250 or less than 60, even though you're trying to take care of these issues with the proper steps. If you've had moderate or large ketones in your urine, or if you have a fruity odor to your breath. These are all the American Diabetes Association recommended red flags to alert your physician if you're experiencing. And again, if you can't reach your physician, maybe it's late at night or it's a weekend, it's recommended that you go to the emergency room with these situations as well. So it's been my pleasure to meet with you today. We do have a diabetes education center here at Titus Regional Medical Center that is ADA recognized. We welcome your calls and questions if you have them. Best number to reach us at is 903-577-6099, or you can absolutely send me an email, and I've included my email address, which is christina.graham@titusregional.com. It's been a wonderful time to be with you. We've had some weather, and I'm thankful that this presentation has come through today and that we've been able to finish this afternoon. And I wish you a safe and a sound week. And again, if you have any questions, please don't hesitate to give me a call. Thank you.